Welcome to SMA's Southern Medicine podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population.
Today, we are joined by Drs. Yumi Shin and Joyce Akwe to discuss vaping-related illness and COVID-19, a topic addressed in an upcoming Southern Medical Journal article authored by Drs. Shin, Akwe, and Daniel Hunt. Thank you for being here.
Thanks for having us.
Thank you. We're glad to be here.
Oh, well, we are delighted you were able to join us today. In your article, An Epidemic Supplanted by a Pandemic, Vaping-Related Illness and COVID-19, you provide a narrative review detailing numerous aspects of the vaping epidemic, including the effect COVID-19's pandemic has had. But before we discuss the medical issues surrounding vaping and COVID-19, please provide our listeners with an overview of electronic cigarettes, including their history, how they work, and the types of devices available.
Electronic cigarettes are battery-operated devices that heat a liquid which produces vapor or aerosol that users inhale. In 1965, Herbert Gilbert invented the first smokeless cigarette. The intention was to replace the conventional paper and tobacco with a safer or harmless alternative, which was consistent of moist and flavored air. Herbert also wanted to create a method by which warm medications could be introduced to the lungs through inhalation in case of any lung disease caused by inhalants. The first electronic cigarette entered the Chinese market in 2003 and subsequently the US market in 2007. Since e-cigarettes entered the US market, marketing has increased significantly, and the design and manufacturing process have also evolved. E-cigarettes were marketed as a healthier alternative to conventional cigarettes. Proponents of e-cigarettes actually argue that e-cigarettes will be of benefit to public health. At that point, e-cigarettes became readily available online, and shops were popping up in affluent neighborhoods, especially in states with less stringent laws on indoor smoking and low taxes on nicotine products. E-cigarettes actually became a gateway for nicotine dependence, especially in young people. E-cigarettes are simply electronic nicotine delivery systems, also known as ENDS, which vary in power and potency. E-cigarettes are electronic power devices with a battery, an atomizer, and a solution cartridge with a liquid chamber. So the atomizer is made up of heating and a vaporizing element. The battery powers the heating element that aerosolizes the solution in the liquid chamber, which is what inhalers inhale. The power is turned on manually by pressing a button or automatically by inhaling. The vape liquid in the liquid chamber of the cartridge usually contains nicotine, flavor, and a delivery system. The most common flavors are candy flavors, fruit flavors, soda, and even alcohol flavors. THC and CBD oils are sometimes used in e-cigarettes. Other components that have been found in e-cigarettes include metal traces such as lead, nickel, or even chromium traces. According to the CDC, some of the components found in the liquid are not reported on the label. First generation e-cigarettes look like regular cigarettes, but the newer versions have rechargeable batteries and refillable cartridges. The second generation has rechargeable batteries and a switch to regulate the frequency and length of puffs. The shape of the second generation e-cigarettes depend on the size and shape of the battery. Third generation e-cigarettes allow for more customization. Fourth generation e-cigarettes have rechargeable batteries and replaceable cartridges that contain nicotine and flavorings. Fourth generations are increasingly popular amongst adolescents. Joel is a popular brand of fourth generation e-cigarettes. It looks like a thumb drive. Its small size and discreet appearance make it easy for the device use to go unnoticed in school settings. These devices contain nicotine in a form that is less irritating to the throat and so tends to deliver higher concentrations of nicotine. The newest devices are colorful and are non-rechargeable. They look like the first generation devices. It looks like we are going in circles with these devices.
E-cigarettes have been associated with adverse effects on multiple organ systems. Could you please explain some of those effects, what they are, including e-cigarettes or vaping product use associated lung injury, which we have heard known as EVALI?
Sure. E-cigarettes have shown effects on almost all organ systems within the body. And so the main effects that we see are in the cardiovascular system, the central nervous system, the gastrointestinal system, and of course, the pulmonary system as well. The common systems that are affected are the GI system and the pulmonary system. And patients who use e-cigarettes can have a variety of symptoms, and that includes things like increase in blood pressure, heart rate, mood changes, tremors, headache, nausea, vomiting. And these patients have also had issues with arrhythmias, pneumonia, and irritation in the upper airways, and have suffered acute MIs and ARDS, which is acute respiratory distress syndrome. Our paper focuses mainly on the pulmonary effects, and initially e-cigarettes were thought to be safer than conventional cigarettes, but there's more evidence that's coming out that it could be associated with lung injury, and it makes sense. With the variety of chemicals that are in the e-cigarettes, those chemicals are inhaled into our respiratory system, which have shown to cause direct irritation. And unfortunately, there isn't just one substance that is the culprit, and it's likely due to several chemicals that are inhaled. So as the e-cigarette liquid is heated, heavy metals are aerosolized, as well as propylene glycol and glycerol. And these are actually ingredients that we see in like smoke generators, like in nightclubs and theaters. And we don't exactly know what repeated exposure over time could do to our lungs, but I would say that it's not good. The main substances that seem to be the biggest offenders, though, are TSH or TCH. Sorry, let me go back. Pause. The main substance that seems to be the biggest offenders are THC, nicotine, and vitamin E acetate, which is an additive in the THC products. There was one study that looked at the bronchoalveolar lavage fluid in patients with EVALI, and they found that 94% of the patients had vitamin E acetate. So we think that the vitamin E acetate may be the problem, but it's not found in all the samples. So again, there may be other substances that are contributing, and more studies are of course needed. So over the years, as e-cigarettes and vaping products have increased, there have actually been an increase in this new disease process known as e-cigarette or vaping product use associated lung injury, which we call EVALI. In February of 2020, right before the COVID-19 pandemic hit the United States, there were more than 2,800 reported cases of EVALI, with approximately 68 deaths attributed to the disease. Unfortunately, EVALI is a diagnosis of exclusion, so you have to rule out everything else before you can say that that lung injury is related to EVALI. And the criteria for diagnosis, it's not extensive. The patient must have used a vaping product in the last 90 days. Other etiologies have to be eliminated, and abnormal imaging needs to be present to say that it's EVALI. And generally on the CT scans of patients with EVALI, you'll find multifocal ground glass opacities with organizing consolidation, diffuse alveolar damage and small centralobular nodular pattern, which can be seen in our hypersensitivity pneumonitis patients.
You indicate in your article that hospitalizations for EVALI reached a peak in late 2019 and rapidly declined to very low numbers of reported cases by January 2020, just prior to the initial identification of COVID-19 cases in the United States, and that presenting symptoms of EVALI, such as cough, fever, nausea, and vomiting, overlap with those of COVID-19. Could you explain for our listeners the potential interplay between vaping and COVID-19?
So hospitalizations for EVALI reached a peak in September of 2019 and rapidly declined to very low numbers of reported cases in January of 2020. This was just prior to the initial identification of COVID-19 cases in the United States. In February of 2020, the CDC decided to stop collecting EVALI case reports. Vaping-related illness may have nearly disappeared because of increased public awareness resulting in risk reduction by users and because of the removal of vitamin E acetate from vaping products. Presenting symptoms of EVALI, such as dyspnea, cough, fever, nausea, vomiting, and diarrhea overlap with those of COVID-19. And generally, during a pandemic, there is a tendency to narrow diagnostic considerations. In April 2020, there was a case report of a patient which reminded clinicians that EVALI should remain in the differential diagnosis for young patients admitted with severe lung injury. As noted previously, EVALI is considered a diagnosis of exclusion. Infectious etiologies must be excluded, but asking patients about vaping exposure is critical to making the diagnosis. Similarly to clinical presentation, imaging findings for EVALI and COVID-19 demonstrate significant overlap. Chest X-rays in EVALI typically shows bilateral multifocal ground glass opacities or consolidation that is symmetrical with lower lung predominance. In COVID-19, the X-ray may initially appear normal, but typical findings include patchy bilateral ground glass opacities and or consolidations that is both peripheral and lower lung predominance, and this is very important. On CT scan, EVALI typically demonstrates bilateral symmetrical ground glass opacities with or without consolidations, predominantly in the lower lobes and subpleural sparings. So, subpleural sparing should prompt consideration of EVALI, not COVID-19. Similar findings, but peripheral and subpleural distributions is common in COVID-19. The CBC in patients with EVALI usually show leukocytosis, or the white blood counts show lymphopenia. Additionally, patients with EVALI do show rapid response to corticosteroids might also favor EVALI in young patients with extensive lung findings. Over 4,300 adolescents and young people between the ages of 13 and 24 were surveyed online, and there was an increased self-reported COVID-19 illness among users of e-cigarettes. This study received substantial media attention, but also was criticized for flaws in its methodologies. Although convincing evidence is lacking, it seems likely that e-cigarette usage would increase the risk of severe COVID-19 lung injury and may increase susceptibility to infections.
Please discuss some of the gaps in knowledge related to vaping and what can be done to help bridge and close this gap.
So this goes back to what we had discussed previously. There are a lot more chemicals in these products that we don't know about, and we do not know how they affect our bodies. The mixtures within the vaping liquids keep changing and are not tightly regulated. There have not been any direct human studies related to these substances. So again, we don't know what the long-term effects will be for our patients. And vaping has not been around for a long time, so we're working in the unknown. What we do know is hypothetical, and as scientists, I think we can postulate and predict, but we have to keep studying and collecting the evidence. I don't think we should be lulled into a false sense that these products are 100% safe, as that's not a guarantee.
Are there any final thoughts you would like to share with our listeners? Either one of you, we would love any kind of pearls of wisdom or thoughts that you would like our listeners to know more about.
Sure. Given the symptoms in patients with EVALI and other viral illnesses, including COVID-19 overlap, we should always make sure we ask about exposure to vaping in patients who present with COVID-19 or other suspected respiratory illnesses. Information about the exposure to vaping is not spontaneously volunteered by patients. The long-term effects of e-cigarettes are not yet completely known, and so we should not stop urging our patients to abstain from any form of smoking.
Dr. Shin, do you have any final thoughts?
No, I'd like to reiterate what we had already discussed earlier, that I think there needs to be more evidence that comes out with e-cigarettes and vaping, and COVID-19 has added just another layer of complications. So I guess we'll kind of see what more there is to come in this field for research.
Well, we thank you very much for joining us today. We appreciate your taking some time, and I think our listeners will benefit greatly from the information you have shared with us today. So thank you.
Thank you. Thanks for inviting us.
Thanks for having us.
We hope you enjoyed the practice of medicine. For more episodes in this series or SMA's The Business of Medicine podcast, go to sma.org/podcasts or subscribe to us on iTunes, Google, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit sma.org. And thank you for joining us.